Welcome. The expression of an infectious disease. There are three factors influence the expression of an infectious disease. First, virulence of the causative organism, the level of exposure or the dose of the inoculum, and lastly, the susceptibility of the host within a poultry flock. Each individual reacts according to the net influence. Each individual in the flock react according to the net influence of these three factors, and the uniformity of exposure and the resistance among the individual in the flock will eventually compose the flock, and the flock influenced by the performance of the each individual in detection and characterization of infectious pathogen. There are two methods, the classical methods and the molecular methods. The classical method of cultivation, isolation, characterization, and immunological assay. These procedures based on the specific molecular methods. These procedures based on the specific molecular genetic characterization of the disease agent, and it's now extensively used for detection and characterization of infectious pathogen. Diagnostic technology today uses a variety of sensitive and specific methods that may not require the causative cultivation, the actual cultivation and isolation of an organism for diagnosis. Rapid diagnosis by using the molecular technique, but yet isolation of an agent still has an importance. The important place in the investigating process, isolates are important in assessing the virulence, the pathogenesis of the causative agent, and in development of vaccine. Virulence, pathogenesis, and development of vaccine. We still need the classical method of isolation. Detecting technology offers advantage in the number of samples that can be tested in the short time, in overall efficiency of the testing. Enzyme-linked immunoassay or ELISA. Antigen capture ELISA is used for viral and bacterial diseases. The polymerase chain reaction and nucleotide probe offer many approaches for identification of infectious agents that have infected an individual bird simultaneously. Statistical analysis of ELISA titer for various infectious pathogens help to assess the frequency and distribution of the infection or vaccine-induced humoral immunity within the flock. Significance of identified pathogen and isolate and detected disease agent should be evaluated for diagnostic significance relative to the case history, clinical diseases, and lesions. Poultry or commercial flocks may experience sequential or simultaneous disease challenge, as well as exposure to agents in attenuated live vaccine. In a diagnostic investigation, both field challenge agent and attenuated live agent may be detected and require further characterization and differentiation. Examples of live vaccine include those for Newcastle disease virus, pneumovirus, infectious bronchitis, infectious laryngotrachitis, infectious bursal virus, infectious bronchitis, infectious laryngotrachitis, infectious bursal disease, chicken anemia, virus, hemorrhagic enteritis, mycoplasma, coryza, pastorella, and others. For example, isolation of infectious bronchitis virus is an important first step in understanding a respiratory disease. If the virus is determined to be new serotype, a significant change in vaccine virus serotype will be required to control the disease. If the isolated virus is indistinguishable from vaccine strain administered at an earlier stage, it may indicate the need for improvement in vaccine administration or point to immune suppression from infectious bursal disease, chicken effect. Some vaccine viruses are readily isolated from several days post-administration. Extended period of virus shedding in a flock may reflect variable immune existing at the time of vaccine administration. For respiratory virus, isolation of vaccine virus for a prolonged period after administration can be indicative of so-called rolling reaction. In this situation, poor uniformity in flock immunity will result in some chicks being resistant to virus infection at the time of vaccine administration. Then, the attenuated virus infection spread from bird to bird, resulting in vaccination reaction of prolonged duration. Attenuated vaccine virus may reacquire virulence characteristics during this process. Rolling reactions and lengthened period of vaccine virus isolation also occur with uneven or ineffective vaccine administration technique. Vaccine virus shed from infected pinmates eventually infect susceptible chicks, causing an even and sometimes harsh reaction within the flock. Differentiating vaccine strain from wild type or failed challenge virus or bacteria in the lab may require molecular genetic sequencing and analysis. The presence of co-pathogen can increase the severity of a viral disease such as infectious bronchitis and the respiratory form of Newcastle disease virus, mycoplasma infection. Elevated concentration of ammonia airborne dust increase the severity of respiratory viral diseases. In this situation, the actual cause of death or economic loss in the form of condemnation and slaughter from respiratory compromise or septicemia caused by Escherichia coli. While the laboratory effort may focus on the viral infection, the cumulative effect of the co-pathogen must also take into consideration for effective treatment and control. This situation requires a comprehensive approach, diagnostic including virology, bacteriology, serology, and pathology. Specific pathogen-free sentinel doors are useful in identifying specific primary infectious pathogens. These are typically used when interference from overwhelming co-pathogen or vaccine strain obscure the isolation effort of primary pathogen. Sentinel doors can be placed in a flock for a specific time and then brought into the laboratory for pathogen isolation and identification procedures. Selective immunization of the sentinel focuses the susceptibility and thereby increases the efficiency of identifying the challenged strain. The relative significance of an isolate are dependent on where it has food safety or public health significance. For example, Salmonella, Escherichia, Campylobacter can be pathogenic for poultry, but even in the apparent absence of disease, they can be significant contaminant on processed poultry or poultry products. Avian influenza virus has a strain have variable virulence among different poultry species, and some strains have considerable public health significance. Disease reporting, the isolation and the identification of certain pathogens carries the responsibility of reporting to state, federal regulatory officials, who in turn have responsibility to report internationally to the World Organization for Animal Health, OIE. The OIE website maintains the current list of international reportable disease, which include Newcastle disease virus, Turkey rhinotracheitis, H5H7 avian influenza, Balloram disease, and other. Quality management, a quality management program to include standard operating procedure for the isolation, identification of infectious pathogen, improve the overall consistency and the quality of the laboratory efforts. A quality management program evaluates laboratory procedures for the yield of relevant and timely data. It involves quality assessment by specific performance parameters and setting limits for susceptible performance and the quality improvement by correcting problems and preventing their reoccurrence. Quality management helps to ensure that the laboratory information is accurate, reliable, and reproducible, with the goal of eliminating or reducing test variation within and between laboratories. Proficiency test lab. The element of the quality program comprise written procedure manual, record keeping, documentation, retention, training, education, evaluation of personnel. Thank you.